First up is Jim Bouder, parent and advocate.
Hello, my name is Jim Bouder. For the past 8 years, I've, kind of as a hobby, been assisting the policymakers and lawmakers in Harrisburg to focus on funding issues that impact the availability of services for our children. In 2004, I was asked to chair the Funding Stream Subcommittee, and the majority of those recommendations were adopted by the department and saved the Department of Public Welfare millions. I also worked with our former Speaker of the House, Dennis O'Brien. We actually sat back in a conference room in the hallway behind us and worked with his chief of staff and hammered out what would become Act 62, Pennsylvania's autism insurance law. What Mike mentioned as one of the means that we have to implement successfully and do away with the need for this particular co-payment plan. So this morning I'd like to talk about a couple of things, but mostly I'd like to talk about fraud, waste, and abuse. In December of last year, the Department of Public Welfare told the General Assembly that because we are in the worst recession in 70 years, because we lost federal stimulus money, and because we are facing a significant deficit, we must make these changes to the welfare code to allow us to collect co-payments. Now, a number of you parents sitting behind me, parents out there, have written your legislators and have gotten form letters back from your legislators detailing these points, point by point. Well, yeah, I'll give it to them. Yes, we are clawing our way out of an awful recession. Yes, we lost federal stimulus money. That's all true. I haven't seen the numbers, but I'm also willing to concede that we're probably facing some kind of a budgetary deficit this year. But the fourth point isn't true. You see, anybody can regurgitate a DPW talking point. This is not true. The only option available to Pennsylvania is not collecting co-payments from families under this specific plan. There are other plans. Now, one thing we parents in Pennsylvania have done for the past decade, when we come here, we don't come here with our hands out wanting the General Assembly to do something for us and put something in our hands. We bring something with us, and we brought something with us today. We brought a very detailed roadmap, a plan that would allow Pennsylvania to achieve its budgetary objectives by enforcing existing law, applying existing law that could have saved $25 million ever since Inauguration Day on an annual basis, but going forward, $33 million this fiscal year, and then millions more in following fiscal years. Again, the department's anticipating saving about $5 million as a result of this co-payment plan, which is probably overly optimistic. We have a plan that will not only, again, meet the budgetary objectives of the Commonwealth, but will also enable us to funnel some of those savings into services that are much in need of being bolstered. Adult services, consolidated waiver services, autism waiver services, services for adults who are going to be on the emergency list for years if we don't address these problems. All right, so let's talk about the waste a little bit. Act 62 of 2008 was intended primarily to eliminate the discriminatory treatment of insurance companies against families who have children with autism, requiring families of children with autism to be able to access health care paid by the private health insurance that they purchase. Now, Act 62 type coverage is available to about 30% of Pennsylvanians. As I mentioned, the savings that Pennsylvania can potentially experience this fiscal year, $33 million a year. According to correspondence with OMSAS at the Department of Public Welfare last December, in state funds, Act 62 saved Pennsylvania $960,000. A potential of $33 million, it saved $960,000. So why are we in this position? Why are we panicking and having to plow forward with this co-payment scheme that will burden parents, burden providers, burden the healthcare providers in the Health Choices MCOs? Why? The reason why is waste. We have wasted an opportunity to successfully implement a very strong law, to implement a law that has teeth, that can force the insurance companies to pay for the claims that they're supposed to pay. So our plan on the policy brief, which is over on the table over there for anybody interested in picking it up and looking at it, is to get a group of people together, including the insurance department, including the Department of Public Welfare, including interested members of the General Assembly, to turn our meetings into not just merely meetings where we talk, but meetings where we talk about what we achieved between meetings. Meetings where we're actually doing something about this and helping families who are faced with these enormous copays. So, then we have abuse. Representative Sterla touched on the evasion of the regulatory review process. Now, a lot of people out there, parents that I've spoken with, don't quite understand how the process works. And I've explained it in the past in relatively simple terms. The General Assembly, the House and Senate, pass a law, and that law tells DPW to do stuff. Now, that do stuff bill is sent to the governor. The governor agrees with it, signs it, and the do stuff bill becomes law. That law is sent to the Department of Public Welfare. The Department of Public Welfare promulgates regulations or makes regulations that they submit to an independent commission called the Independent Regulatory Review Commission, or the IRC. That commission exists for three primary reasons: to make sure that DPW doesn't overstep its legal bounds in implementing the Do Stuff law, to make sure that the regulations are in keeping with the intent of the General Assembly that created the Do Stuff law that the governor signed, and also, and most importantly, to ensure that the public interest is given a voice in the process, that the public interest is preserved and protected. Now, with Act 22, the Department of Public Welfare asked the Senate of Pennsylvania to insert language that they say give them a pass of that accountability process. And it was that pass of the accountability process that has gotten us in a place where we are today, with a co-payment plan that DPW doesn't even like, that the Health Choices managed care organizations say can't work, that are going to be charging enormous co-pays to families. Now, then we have abuse of power. We have abuse of power, we have abuse of authority, and lastly, I think we have abuse of consumers. Now, I received my letter from DPW yesterday. You know, DPW is assuring us that they can do this. They're assuring us that they can implement this on a fast track. This is coming online on October 1st for new MAS recipients, and it's coming online on November 1st for existing medical assistance recipients. Well, according to my letter, DPW believes I am making $44,300 more than I'm actually making. And in order to calculate what I'm actually making, all they needed to do is add together two pay stubs. Now, I have a salary position that pays me the same sum twice a month, 12 months a year. It's the same sum. All they had to do is add together two pay stubs, and they still got it wrong. So now our family is in the process of having to file an appeal with no guarantee that that appeal will be resolved by November 1st. So we're looking at an additional $200 more in co-pays on a monthly basis. Who can afford that on a middle income? So this is what we want to do. We want the General Assembly to help us out. We are calling on the General Assembly to look at our plan. Give us an opportunity to talk to you about this plan and implement it and begin saving the Commonwealth the money we know this plan will save the Commonwealth. In the meantime, we need to send a strong message to the governor to rein this copay plan in. We can stop this now. The governor has the power to stop it now. And ultimately, if the General Assembly and the governor is interested in some kind of a cost-sharing plan, let's follow the rules. Let's don't bypass the rules. Let's don't give an executive agency the ability to unilaterally put in place rules that are harmful to families. Now,